CAC Global Summit 2020, hosted by Seoul from June 1st to 5th. This session was held to share the COVID-19 quarantine measures of SMG and major global cities.
Good afternoon, ladies and gentlemen. I am Hee Jung-Yoon, MC for this session. First of all, I would like to thank you for being with us today. The third session is about quarantine measures. The world is in a panic due to the global pandemic. If a quarantine system in cities are well operated, it can protect citizens' health and lives and prevent social chaos. In this regard, I will invite cities' quarantine officials and quarantine experts from home and abroad to talk about future direction cities around the world. We will share successful example of quarantine measures taken by each city, and then we will discuss a new model for contagious disease prevention with our panelists. We are running today's discussion live via the Seoul City's YouTube channel, and the people around the world are watching this in real time. Now, I would like to ask Professor Choi to lead the session.
Good morning, ladies and gentlemen. Good afternoon. I am Jae-Phil, Division Chief of Infectious Diseases at Seoul Medical Center. Now, this unprecedented, very powerful disease, COVID-19. Now, against the spread of COVID-19, it's not only the central government's response, but also the municipalities' response has become very important and instrumental in protecting citizens' lives and health. As such, we have invited the heads of health response, not only in Seoul, but also in other cities around the world, to share their experience in fighting against COVID and also to look toward the future. Now, first and foremost, we have invited Mr. Baeg-Ju, Director General of Citizens Health Bureau of the Seoul Metropolitan Government, to tell us about the COVID-19 response of Seoul, the experience and the success factors. So now let me invite Mr. Na to come forward to deliver a presentation.
Yes, very nice to meet you, everyone. My name is Baeg-Ju. So let me take you through how our city government has responded to the COVID-19 outbreak, what has been key to our success, and also some lessons or takeaways. First of all, as we stand, as of yesterday, so this is as of June 2nd, we have 876 confirmed cases in Seoul and 11,541 total in Korea. About 70% of the 876 actually contracted the virus through overseas contact or through collective infections. On a cumulative basis, we have 4 deaths in Seoul. The case fatality rate is just 0.5. So compared to the nationwide average, this is actually lower. So the key to this kind of successful response for us has been our quick and transparent response, citizens' participation, cooperation and solidarity, an innovative and creative approach. So let's look at our quick and transparent approach. We have about 50 designated screening clinics in Seoul. And so we use the PCR testing method. More on transparency. So when there's a confirmed case identified, we look at the person's movement after presenting with symptoms to establish who may have come into contact with this person. And so we disclose this information on our website so that people can be cautious.
And that is about the city of Seoul, so the cities against COVID-19. So we have also opened up this online website to share information about Seoul's strategy and responses so far. And also, we were able to show our innovation and creativity. So let me also give you some more details here. So now this is what was led by the central government mostly, but still now the test kit development, the PCR
굉장히 정확도 높은
fast testing kit was developed. So we were able to get the results within 6 hours of testing. So that helped immensely. And then also the
것들을 새롭게
methods of testing. So we also came up with new approaches, for example, drive-through or walk-through, to allow easier and faster and more convenient testing for the citizens. And also when confirmed cases occur, then we also do tracing using their smartphones, because sometimes it is difficult to rely only on their statements. So we would also utilize their GPS information on the smartphone in order to do more detailed tracing. And one more thing, and that was about the citizens' participation. We tried to encourage the citizens to take public transit at different times so that we will be able to reduce the density in public transportation. And as you can see, the citizens were quite participatory. We've had a lot of success factors, but then now I do believe that there are also more work has to be done. We are planning to more finely segment them into 7 so that we will be able to have differentiated strategy per emergency level. So we are trying to systematically build up our capacity against epidemics and infectious disease so that we will be able to continue to serve as a model of infectious fight against infectious disease.
모델이 될 수 있도록 표준이 될 수 있도록 계속 노력해 나가려고 합니다.
So thank you very much for the invitation. I'm very happy to be able to present our experience in Los Angeles County. I think we're all very inspired by the work that we've seen in South Korea, and we're trying to emulate a lot of what you have done. Of course, the initial response in the United States and Los Angeles specifically was hampered significantly by the lack of available testing. And so I'm going to talk a little bit about that, but I'm going to talk more about nursing homes, which have been a significant part of our outbreak. So I wanted to talk a little bit about specifically what we've done in nursing homes, because that's been the largest single group that's had experienced death in Los Angeles. So as I said, it's been a very significant problem. So nursing homes in Los Angeles County, about 38,000 residents, which is less than 0.5% of the population, but about 10% of the total cases we've identified have been in nursing homes, so about 5,300 cases. And then 48% of the total deaths in Los Angeles County have been in this less than 0.5% of the population. So we have expended a huge amount of effort trying to prevent these outbreaks from continuing. Unfortunately, we got we have had a lot of outbreaks, and so we've kind of gotten this under control a little bit later than we wanted to. But what we've done to try to decrease the risk of continued outbreaks going forward is quite an intense response. So first, we have entry screening for symptoms of COVID and temperature, and anybody who has those symptoms would be excluded from the skilled nursing facility. It's not here on the slide, but we've also stopped visitation of all non-essential people into these nursing homes. We've gone to universal source control starting in early April, and that means masking of all staff and residents who can wear non-medical face covering, like a scarf or other things, to try to decrease the use of personal protective equipment, which is still somewhat limited here in the county. We've canceled communal dining and activities, and we've asked most residents to stay in their rooms as much as possible to decrease the risk of transmission in group settings. And we've also just instituted screening testing. So we've had actually baseline testing where we've gone into every facility and we're testing every single patient and every single healthcare worker in these skilled nursing facilities. And then if we identify any cases, we would isolate those symptomatic cases, and we would quarantine any close contacts for 14 days to decrease the risk of additional transmission. And then once we clear those infections, so meaning 2 negative tests 1 week apart, once we clear those outbreaks, then we would actually initiate screening testing. So because we've seen probably most of these cases coming from infected staff, we've concentrated a lot of our effort on staff. So 1/4 of the staff will be tested every week and 10% of the residents as well. And anytime we identify any positive cases, then we would do what we call response testing, meaning testing of the entire facility, all residents and patients as well. And then that goes along with, and again, an aggressive approach to cohorting. So we have 3 cohorts set up in every skilled nursing facility, including a COVID positive unit, which is usually manned by staff that only works in that unit. So we keep the staff entirely separate. They're blocked off with either physical doors or temporary barriers. Additionally, we have a quarantine unit where we're trying as much as possible to quarantine patients individually in rooms. And then we have a non-COVID unit for people who have recovered from COVID or who are negative upon testing. So that has been our approach in skilled nursing facilities. And, it's been an evolving approach, but so far we're starting to see some improvements in that, and with the numbers of cases going down over the last month. And the way we're doing this is we're actually staging the reopening, meaning that, and I'll show you in a second, we have multiple stages. So, and that's going to be, and the ability to go to the next stage is going to be based upon our success at the current stage. So we're going to evaluate how we're doing currently. We're going to make sure that we have plans for reopening that are in place before we reopen. So we hope that we can continue through stage 2. We've not even completed stage 2. We have not opened up things like museums and cultural centers and religious and all religious services yet, but that is planned for the near future. But we're hoping that we can continue to open things up slowly as the virus allows us. Of course, we've had some recent challenges with some social unrest, and so we're going to have to see how that goes over the next couple of months. But the hope is that over the summer that we may be able to get to stage 5 and at least close to normal life, at least with masks and social distancing in the near future. So that's our hope. We're not there yet, but we are definitely working on it.
Let me introduce the next speaker, who is Mr. Ewout van Nooy, the medical doctor at the Public Health Service of Rotterdam. He also comes to us with extensive experience in managing infectious diseases like SARS, MERS, and COVID-19.
Yes, hello to you all. I hope you can see my presentation. Yet, I think. There it is. So thank you very much for your invitation. It's an honor to explain a bit how we try to tackle this coronavirus outbreak in the Netherlands, and especially in Rotterdam. That's the public health service region where I work. Globally, a lot of ships were not anymore allowed to enter. So a lot of cruise ships and cargo ships were waiting at sea. And we decided to have some cruise ships coming in Rotterdam under conditions. So they had to notify if they had cases on board, so we could put the ship on a quarantine place and get the sick people or the people of the ship or test them in a controlled manner. All ships have to send in a maritime declaration of health, but the captain has to send it in, and the public health service screens all those positive declarations. And in total now we had 2 big outbreaks on ships in the port of Rotterdam. But thanks to a good coordination and good communication with the captain, we were able to deal with those outbreaks in pretty well. What we learned, there was a lot of media attention for outbreaks on ships, and so we tried to have open communication to explain our policy but also with the partners working in the harbor. For example, pilots who have to go on board of the ship when it's entering the harbor, the big cruise ships, for example, and cargo ships. Those Dutch pilots, they want to know if there is coronavirus on board. And if so, they want to take the proper measures, such as the use of personal protective equipment. Especially the last month, we're now slowly trying to move to a more track and trace approach. And to manage that, we upscale our public health service. We are upscaling our testing capacity, and to start with a more severe isolation quarantine policy to replace the social distancing and to open up the economy again. And the elderly care facilities, well, that's a special interest to put attention on, and a combination of stringent testing policy, isolation and quarantine proved to work. But you have to be really fast. So when you see a first case, you really have to jump on it and to stop a big outbreak from happening. And in the port, it's very important to have also your timely notifications and good communication to the international stakeholders around the ship, and a very clear command structure to deal with an outbreak.
Chair of the meeting, ladies and gentlemen, it gives me great pleasure to attend this virtual meeting. Today, we are sharing the experience in fighting against COVID-19, which is of great significance to enhance the global response to the virus. The COVID-19 infection in Beijing went through 4 stages. First period is the infected cases from outside Beijing. The second period is the infected cases from outside Beijing mixed with locally transmitted infections. The third one is infected cases from overseas, and the fourth one is the regular prevention and control. By now, a total of 594 cumulative confirmed cases had been reported, among which 581 cases had been cured and discharged from hospital, and 9 people died. Reported in Beijing, we have responded rapidly and activated the response system for public health emergency the very next day. And on January the 24th, the response level had been upgraded to the highest. We have mobilized all parts of the government, of the society, to take joint action against the virus. Second, we have conducted the epidemiological investigation and strictly controlled the sources of infection. An investigation team of 3,500 plus people was established to be on duty for emergency response around the clock. The epidemiological investigation was carried out within 2 hours after a case was reported, and we worked hard to trace the source of infection and manage the close contacts strictly. By now, we have traced and managed 5,324 close contacts. We have ensured 100% timely epidemiological investigation of confirmed cases, 100% standardized management of close contacts, and 0 infection among disease control personnel. Extensive mobilization and social participation. Government departments, enterprises, and individuals are required to jointly shoulder the responsibility of epidemic prevention and control. We organized community security guards and volunteers to participate in the closed-off management of residential communities, checking the body temperature of residents and providing daily necessities to those under medical observation at home. That's reducing the flow of people during the peak. Beijing Center for Diseases Prevention and Control formulated and issued 78 epidemic prevention and control guidelines for key places and groups to provide science-based guidance to the public. Next, we will continue to do a good job in the regular prevention and control of COVID-19 and make preparations for a possible resurgence of infection in the upcoming autumn and winter. We will further deepen international cooperation and fight against the global threat brought by the virus together. Ladies and gentlemen, let's work together to strengthen cooperation, tide over this difficulty, and build a global community of health for all. Thank you.
Please, Carlos Montana, could you share your experience? We can't hear you.
Thank you very much. I will do my presentation in a comparative perspective. And I would like to start by setting the stage in which you can observe from this graph produced by the a group in Seattle that Spain is the country in the world with the highest mortality from COVID per million people. And within Spain, Madrid and Barcelona are the highest. So when we are talking about Barcelona, we really are in a situation that's extreme globally and maybe just comparable to New York, although I don't remember the metrics in New York as well. So the case of Canada is doing much better. Of course, it's not the success of South Korea, but it's in the middle of the comparative approach to mortality in wealthy countries. And I would like to end with some consideration of what are the key elements that differentiate these two cities. It was the worst of times and not the best of times, but not so bad for Toronto. So widespread testing, universal healthcare system that's single payer, in which there is no two tiers. So the capacity is there for when it's needed, and there is full collaboration, and the public system doesn't need to pay the private system to, say, provide testing facilities or to conduct needed services for them, as was the case in Catalonia. And the fact that there was public health preparedness and know-how. On the other hand, in Barcelona, we had basically every step of the way there was a failure. So among those that I didn't mention was that the colonialization and created a lack of access in the when these services were needed. For example, the case of nursing homes who could not be sent to hospitals of reference, and also insufficient beds, lack of personnel, and drainage of funds towards the private sector. All of these made the management of the epidemic, once it was in the community, much harder than it should have been. Finally, and in my last slide, I would like to, what was lacking at the end of the day was government investment in public health and in a prepared public health workforce that had the expertise to deal with an epidemic of infectious nature, and that would conduct aggressive public health measures of quarantine, early testing, tracing, isolation, and then social distancing, and massive population-wide quarantine or isolation. So this is my experience. I hope that we learn from this error, that we learn from Asia, as Canada did with SARS and with this epidemic, and that the future will be much easier for us. Thank you very much.
So we are in the midst of the COVID-19 outbreak and sharing how each of the cities are combating the outbreak. I think it was a very informative session. So quarantine and disease prevention and control is very important. So through collaboration, cooperation around these key themes, I hope we can find better ways to address and respond to COVID-19. Thank you very much.